Hello, good morning, students. Welcome to this special expert lecture, which I'm going to deliver on thyroid gland and thyroid hormones and how they regulate our metabolism and other functions. Thyroid hormone controls the metabolism, growth, and many other functions of our body. Thyroid gland produces thyroxine or tetra-iodo-thyronine, commonly called as T4, and tri-iodo-thyronine, which is called T3. Thyro-tropin-releasing hormone (TRH) from the hypothalamus and thyroid-stimulating hormone (TSH) from the anterior pituitary gland and T4 work in synchronous harmony to maintain proper feedback mechanisms and homeostasis. In the picture, we can see the hormones being secreted by the hypothalamus, thyroid, and the pituitary gland and working in harmony. There are two conditions related to the function of thyroid gland. One is hypothyroidism and another is hyperthyroidism. This hypothyroidism is caused by an underactive thyroid gland, while hyperthyroidism is caused by increased thyroid gland function. Iodine is an essential trace element which gets absorbed in the small intestines, and this iodine is an integral part of both T3 and T4 hormone. Decreased iodine intake can cause iodine deficiency and decreased thyroid hormone synthesis. Iodine deficiency can cause cretinism, which is a condition characterized by physical deformity and learning difficulties. It can also lead to goiter, myxedema, coma, and hypothyroidism. Source of iodine, as we all know, include iodized table salt, seafood, seaweed, and vegetables, etc. Thyroid hormone affects virtually every organ of our body and regulates their functioning. These are number one, heart; number two, central nervous system; number three, bones; number four, autonomic nervous system; number five, metabolism; and number six, gastrointestinal tract functioning. Let us see how the thyroid gland and its hormones affect the heart functioning. Actually, thyroid hormone increases the expression of the beta receptors in the heart and thus increases the heart rate, stroke volume, cardiac output, and the muscle contractility. If we talk about the growth during the childhood, it has been observed that in children, thyroid hormones act synergistically with the growth hormone to stimulate the bone growth. Another most vital organ in our body is lung. The thyroid hormones stimulate the respiratory centers and thus lead to increased oxygenation because of the increased perfusion of oxygen to the blood. The skeletal muscles which support our whole skeletal system gets affected from the thyroid hormones. Thyroid hormones cause increased development of type 2 muscle fibers, and these are fast twitch muscle fibers capable of fast and powerful contractions. Our physiological metabolism is comprised of anabolism and catabolism, and both are affected by the functioning of thyroid hormone. The thyroid hormone increases the basal metabolic rate, leading to increased oxygen consumption, respiration rate, and body temperature. So, in nutshell, if we summarize the functions of thyroid hormones on our metabolism, we can say that number one, it increases the basal metabolic rate. Number two, depending on the metabolic status, it can induce lipolysis or lipid synthesis. That means the lysis of the lipids or the fresh synthesis of the lipids. Both functions can be regulated by thyroid hormone. Number three, it stimulates the metabolism of carbohydrates also. And number four, stimulates anabolism of proteins and it can also induce catabolism of the proteins in high doses. What is the impact of thyroid hormone in central nervous system? Number one, during the prenatal period, it is needed for the maturation of the brain. Number two, in adults, it can affect the mood. Number three, hyperthyroidism lead to hyperexcitability and irritability. Number four, hypothyroidism can cause impaired memory, slowed speech, and sleepiness. And finally, number five, thyroid hormones affect fertility, ovulation, and menstruation. Now, let us check which are the laboratory tests which are used to screen the abnormality of the thyroid gland and the thyroid hormones. Initial tests to screen thyroid abnormality are TSH and T4. Their levels determine whether the abnormality arises from the thyroid gland as a primary problem, or pituitary gland as a secondary problem, or hypothalamus as the tertiary problem. In hypothyroidism, thyroid gland is not releasing enough thyroid hormones. Therefore, TSH levels will be appropriately elevated while free T4 levels will be lower. In contrast, in hyperthyroidism, free T4 levels will be abnormally increased and TSH levels will be appropriately decreased. The symptoms of decreased metabolic rate are number one, bradycardia, that is abnormally slow heartbeat or heart action. Secondly, fatigue, the person feels tired the whole day. There could be cold intolerance, that means in the winter the person is unable to withstand the cold weather. There would be weight gain in such persons. The appetite will be poor. There might be hair loss in general. The skin will be cold and dry, and the person may suffer from constipation. Hypothyroidism or decreased metabolic rate is exhibited by different organs and systems. There will be some pathological changes to our muscles, and then it is evident by the stiffness of the muscles, cramps in the body, and entrapment syndrome, etc. There might be generalized myxedema, that is firm inelastic edema, dry skin and hair, and loss of mental and physical vigor. Myxedematous heart disease can also develop in this situation, and if we check the skin texture, it would be puffy appearance with duffy texture. The person's voice changes. The hoarse voice with difficulty in articulating the words are normally speaking, that is affected in cases of hypothyroidism, and very commonly pretibial and periorbital edemas are observed. Pretibial means just before the tibial bone, and periorbital means around the eye socket. So now we are studying now symptoms of hyperthyroidism. In this condition, the patient feels heat intolerance. There is a weight loss drastically. The appetite is increased. There is a lot of sweating because of the subcutaneous blood supply increases. The patient feels weakness, fatigue, and there will be very commonly pretibial myxedema. A condition called onycholysis is also observed, that is separation of the nails from the nail beds. Continuing the symptoms of hyperthyroidism, there are observation that patient will have lid lag. This is a condition when someone is looking down, then sclera is visible above the cornea as we can see it clearly in the attached picture. There may be condition of lid retraction. This is a condition when someone is looking straight even then sclera is visible above the cornea. These patients may have goiter, but that would be like diffuse, smooth, and non-tender. The symptoms of tachycardia, that is increase in the heart rate, palpitation, and irregular pulse, that is because of atrial fibrillation, are the symptoms of hyperthyroidism. Other symptoms of hyperthyroidism include chest pain, hypertension, abnormal heart rhythms, heart failure, particularly in the elderly patients, and widened pulse pressure because systolic pressure increases and diastolic pressure decreases. The musculoskeletal symptoms of the hyperthyroidism are fine tremors of the outstretched fingers, face, tongue, and head can also be involved. Tremors respond well to the treatment with beta blocker drugs, and myopathy affecting the proximal muscles is conspicuous. There can be osteoporosis, and that will be the direct effect of T3. The neuropsychiatric symptoms of hyperthyroidism include restlessness, anxiety, depression, emotional instability, insomnia, tremors, and many a times hyperreflexia, which is hyperactive or repeating reflexes of clonic type. Regarding the treatment of hypothyroidism, the standard treatment involves daily use of the synthetic thyroid hormone like levothyroxine. This oral medication restores the adequate hormone levels in the body, reversing the signs and symptoms of hypothyroidism. Patients will start to feel better soon after start of the treatment. Medication gradually lowers the cholesterol levels elevated by the disease and may reverse any weight gain of the patient. Treatment with levothyroxine may be lifelong. However, the dosage has to be adjusted as per the TSH levels, which should be observed and checked every year. Now, coming to the treatment of hyperthyroidism, thionomides are commonly used to treat hyperthyroidism. Actually, they stop thyroid producing the excess of hormones, and the main types used are carbimazole and propyl thiouracil. Patient need to take the medicine for 1 to 2 months before he notices any benefit of the medicine. Sometimes beta blockers are given to help relieve some of the symptoms associated with hypertension. Once thyroid hormone levels are under control, dose may be gradually reduced and then stopped. However, some people may need to take the medicine for several years or even for life. Coming to the mechanism of action of antithyroidal drugs that work in the thyroid gland, and these are perchlorate. Actually, this drug inhibits sodium iodine symporter and thereby blocks the iodide uptake. Thionomides, they inhibit the TPO and they block the thyroid hormone synthesis, while iodide in the concentration more than 5 mg inhibits sodium and iodine symporter and TPO both. So blocks the iodide uptake and thyroid hormone synthesis at the both levels, while the lithium inhibits the thyroid hormone release. There is another category of antithyroidal drugs that work in peripheral tissues and not directly on the thyroid gland, and examples are number 1, propyl thiouracil or thionomide, number 2, dexamethasone, number 3, amiodarone, and number 4, propranolol. Here it is to be noted that these drugs inhibit the conversion of T4 to T3 and thereby reduces its activity. In such cases where hyperthyroidism cannot be treated by these medicines, the two other alternative treatments are number 1, destruction of the thyroid active tissue by radioactive iodine treatment, and number 2 is the last resort surgery and removal of thyroid gland surgically. That's all. Thank you very much. And also do subscribe this channel. Please give your feedback about this lecture in the comment section. Bye bye.